Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were discussing Shwas as a Kulaja Vyadhi, and I have put forward in front of you how, with the help of Ayurved treatment, we can try. Again, I am not claiming anything. We can try to reduce the intensity of this Kulaja Vyadhi into next generation. And in that discussion, I had discussed with you that we should give Rasan treatment to both husband and wife, after conception to the wife, and after delivery to the baby for few months, not few months, but for a long period. So this is the ray of hope in the Kulaja Valley, which can be given only by the Ayurved science. In today's discussion, I am putting forward on this background of Kulaja Vyadhi a different discussion which is very important from my point of view in the future. Let us start with this. We have discussed that Shwas is a Kulaja Vyadhi, Shwas or Prameha, which are discussed in the text, and it goes into the next generation. In any seminar, in any open lectures of Ayurved, or you will see articles which come on Ayurved in the newspapers or on the in the media, one common sentence is regularly seen, that there should be a research in Ayurveda. Now everyone says there should be a research on the basis of modern science and etc., but no one tells what research exactly they mean with. Are you going to discover fourth dosh or eight dhatu, or any more agni than the discussed in the grantha? What do you mean by research? See, basic principles of Ayurveda are so strong and concrete that I don't think that any addition we can make in it, in spite of this modern era. I am going to give this lecture on these principles of Ayurveda and how they can be proved on the basis of modern science in the course of the time. So, when you are saying, everyone is saying there should be research, it is a very common sentence now, but no one tells us that what they exactly mean with the research in Ayurveda, because basic principles of Panchavati Siddhanta or Tridosh Siddhanta etc. is so fantastic and so concrete that I don't think that there is any changes can be done on the name of the research. Then what is the area of research in Ayurveda? This is again my point of view, and we are discussing this topic on the background of the Shwas as a Kulaja Vyadhi. Now in the last 2-3 lectures we are discussing as a Kulaja Vyadhi, and I told you that how we can help on the basis of Ayurveda to reduce the intensity in the next generation. At least we can try, because we have scope on the basis of treatment or medicines in the Ayurveda. Now, in my point of view, this is the area of research what we can do now in this modern era, and which is very important, helpful to the mankind in the future. As I said, we Tridosh Siddhanta, Panchavati Siddhanta etc. are so concrete that there is hardly we can change them or we can add them. But such patients with family history of Shwasa Vyadhi is going into next generations since ancient period, and we are giving treatment of Ayurveda to reduce the intensity. How you will evaluate this effect of treatment in the next generation. And here I think the research is really needed. In modern era, we have a biotechnology which is advanced, we have a genetic science which is advanced, we can evaluate each and every chromosome in the body. So we can make a joint research project with this science and treatment of Ayurveda. I will explain you in detail. For example, there is a family history of the Shwas Vyadhi, and the couple is now asking you to prevent or at least intensity in the next generation. With the help of genetic science and or biotechnology, or what you can say, we can evaluate the present genetic structure of this couple, give medicines of Ayurveda without compromising our principles. So, give medicines or make panchakarma, as I said in last discussion, of husband and wife. Give both rasayan chikitsa or whatever medicine you want. Give after conception, give to the mother, and then after delivery, give to the baby. So this protocol will be on the basis of Ayurveda as a rasayan chikitsa, and there will be no any interference of the principles. Side by side, we can have a genetic evaluation of both husband and wife, and after delivery, we can evaluate the genetic structure or chromosomal study of the new infant. Of course, we should evaluate this clinically also, definitely. Is really there a symptom wise or intestinal symptom? But with one side Ayurvedic treatment and on other side evaluation on the basis of genetic science or biotechnology, both the science Ayurveda and these sciences are on their without any interference between the principles of both science, but we can have a follow with these sciences and treatment of Ayurveda on the principles of Ayurveda without compromising. So we can study that if there is any structural difference of the chromosome or its effect clinically also can be evaluated, and this research will be helpful for the mankind, because if we can see that okay, the chromosome structure was presently before treatment was say XYZ, and after taking treatment it changed to, or at least the intensity or some difference between the next baby, also with the combination of the clinical statistics or clinical symptom, and this combination of both sciences without compromising the principles, we can have a good research project. Of course, I know that this is not a OPD level work. It will require a good government support, it will require or a big institutes, and it will require a good financial aid, and most importantly a far more time interval for the study. But research, any research project is time consuming, is a work of patience, and it requires a good financial aid. So many researchers are going in the world on the in the medical science. If this project is taken by any institute or government and it is programmed in a very good manner, in a purely scientific manner, then I think we can have a good results or a good clinical data that whether treatment of Ayurveda and these genetic disorders, anyone, not Shwasa, maybe Prameya or something, if there is any effect or we can help on the basis of Ayurvedic medicines to reduce the intensity of the Kulaja Vyadhi in the next generation. I will be happy to have your views on this, and specifically I had taken this topic today because only research in Ayurveda is required, research in Ayurveda is required, and there is no any view regarding this research is told by anyone. I will like your comments and we will come with the next disease in the next lecture. Thank you very much.